When Lyme disease treatment fails, could it be Babesia? This is part of a common sense Lyme disease series where I address questions that come up in my practice, cases that I've seen in my practice. So let's begin. Babesia is important because it's a common co-infection. It's in the same tick. We typically target Lyme disease, but with doxycycline, you're not going to get the Babesia treated. It's commonly missed. It can delay recovery from my experience. My patient didn't improve after doxycycline. Babesia was finally diagnosed. It was only then with the treatment for Babesia, which was azithromycin and atovaquone, that they did well. Now, Babesia, a particular concern because in addition to from a tick, you can have it from a blood transfusion. The recipient has been known to be well until they get a blood transfusion, and then they go back to the donor, and the donor is not even aware they're sick. Babesia can also be passed from mother to child. There's an article where two mothers had Babesia during their third trimester. They delivered a healthy baby, but the babies both returned a month later with Babesia. So therefore, mother-to-child transmission is possible, even though I haven't seen those cases. Now, Babesia is typically one of those diseases where you can be critically sick. It can be found in the red blood cells, which leads to hemolysis, acute hospitalization. It's a high-risk situation. It can lead to pulmonary fibrillation, pulmonary edema, and has been fatal in a couple of cases. Where I deal with Babesia is they're not acutely sick in the hospital, but they're sick and they're not getting treated with just Lyme disease. Now, doctors are divided over this. Some doctors assume that if you can't see it in the red blood cells, if you're not in the hospital, then it can't be Babesia. My observation is that there are people who are well, people who are really sick, but people who are chronically sick, failing treatment for Lyme disease, often have Babesia, which needs to get treated. Treatment used to be clindamycin and quinine, but that had too many side effects. So atovaquone and azithromycin came along. It's marketed as Mepron and Malarone. I tend to use the oral form, which is the Malarone. Also, terfenequine has come along as a possible additional therapy or alternative therapy. It's once a week, at least to start with. It's something I don't have too much experience with, so I'm still learning as we speak. The takeaway is that Babesia is in the tick. I find that Babesia is very helpful in someone who has an unexplained illness, who has been treated for Lyme and not getting anywhere. I have patients at times that appear to have Babesia and Lyme disease. They might have sweats, they might have air hunger, and I might introduce treatment for Babesia at the same time as Lyme, from my experience. And we need more work on this area. There has been some thought that, well, you don't have to only have to worry about people who are immunocompromised. My feeling is that most patients I see are not immunocompromised themselves. They may be suppressed a little from having Lyme and Babesia, but I have to protect and monitor all my patients. So thank you for joining me for this Common Sense Lyme series. Have a good day.